Hello everyone, a very good evening to all of you who have joined me live and who will be viewing this video later. I hope all of you are safe and sound at home, and today I'm here to talk to you about acne management. Now a lot of you might think that acne is such a simple issue. All you need to do is probably get just a simple ointment from the pharmacy and you're good to go. But acne is more complex than you could possibly imagine. Now understand that acne has got many causes. For example, some of the well-known causes are the excessive oil production on the skin. Then there is a D.V.L turnover, which means that your dead skin cells are not getting removed efficiently. There is extra growth of the cutis bacterium acne, which is responsible for these acne lesions, and causes hormonal changes. Along with this, there are also a lot of triggers or triggering factors which can aggravate the acne. Okay, some of them again include wearing a mask. Now you all know that there is a term called maskne. Only simply it could be because of the fabric of the mask that you're using, or it could be simply just the humidity and the heat that is developed under your mask, which has led to the acne. Now, if you are a person who is taking medications for other reasons or other problems, then again that can trigger your acne. And again, there are so many other triggering factors for acne. Even the products that you put on your skin can trigger out acne lesions. Okay. Now, having said this, you understand that there are so many causes, so many triggers. That is the reason why acne is not a curable condition. Of course, we can find correlation between hormone and acne. In that case, if we treat the hormones, yes, acne gets better. If we find that our food is triggering acne, and if we have a good food management, yes, our acne gets better. But there is no single cure for acne, meaning there is nothing such as one cream or one procedure that will ensure that you never develop acne for the rest of your life. Okay, so that's what I say. That's what I mean when I say that there is no cure for the disease. However, there are so many treatment options that is now available for acne. Some of them which were not available earlier, and many newer versions of the same treatments are also now available just for the ease of managing acne. Now, why do we have so many treatment options for treating acne? Obviously, because every person's skin is different, their skin condition is different, their skin type is different, the severity of acne, the reason as to why acne occurs, their skin responsiveness to the treatment, and there are so many other factors that will influence how a management, how the treatment for acne will work in everybody. That is why there is no single management for all types of acne. Okay. Again, you still need to know all these treatment options, because right now you will have somebody in your house, your family, your friend, your colleagues, or someone who is suffering from acne, or you yourself might be developing these acne flares cyclically. Okay, so always having these treatment options in mind will always give you a better chance at choosing the one that is right for you. So you need not get scared when your dermatologist or doctor put forth all these treatments or a combination of treatments. Usually it is a combination of treatment that is given so that your acne is addressed, your acne sequelae such as pigmentation and scarring is addressed, your triggers such as diet and hormones are addressed. So that is why a combination of treatment will always work better than a standalone or a single therapy. Okay. Now with this background, let's move up the ladder of acne management. The first and the most basic thing in managing an acne, you would not believe me if I told you, is washing your hands. As bizarre as it may sound, you need to understand that as Indians, we tend to eat a lot of oily food, and we will not most of the times wash our hands properly with soap, right? We are always in a hurry. Or imagine you are in shopping malls where many a times you do not have soaps and you just have to wash off your hands with water and dab it dry in tissue papers. So all this will leave the oil lingering on your hands, and that again, when you keep touching your face, when you keep adjusting your hair and things like that, again it is going to allow this oil to sit on your skin, clog the pores, and again develop acne. So believe me or not, having unclean hands is what is the most important cause for triggering an acne, rather than just actually eating the oily foods. Okay, so always keep your hands clean. The next thing in the management is washing your face. We all know why cleansing is important, because on a day-to-day basis we are exposed to so many things, from sunlight, from pollution, from dust, and the products that we are putting on our skin, the makeup and whatnot. So it is only essential that we cleanse off these agents and let our skin to breathe, and then we give it the active ingredients that is actually required to help control these acne lesions. So cleansing is very, very important, and this is the thing, this is the starting step for your acne management, right? And this is also the step where you need your dermatologist's help. Now, like I said, it's not as simple as just picking up a product from the supermarket or from the pharmacy and start using it. When a dermatologist is going to view your acne, they are going to give you a wholesome approach to your acne management, which will include your diet modifications, probably the kind of creams and products that you should be putting on your skin, your skincare habits, if I may, and then comes your treatments, which can be just your topical agents or certain procedures as well. So once your skin is observed, it is cleansed, your dermatologist will try and identify your skin type, the current state of your skin, whether it's sensitive, irritated, or it's still calm, whether it is hydrated, and looking into so many things, they would be prescribing you a cleanser. More often than not, an oily skin usually gets salicylic based cleanser prescribed to them for the right reasons, because as we all know, salicylic acid loves oil. Okay, so it has the ability to penetrate the oil glands and it works to reduce the oil from them. At the same time, it also works as an antibacterial. That means it kills the bacteria which will trigger the acne lesions. It is also anti-inflammatory in nature, which means if there are red lesions on your skin, it helps calm these lesions as well. All these things make salicylic acid the #1 agent in your cleansers or in your skincare or even in your peels. Now, once you have cleansed your face, if you are say a person who's in the middle age or slightly older person who has developed acne, essentially an adult onset acne, then for those patients I would personally prefer to give, along with salicylic acid, a little bit of glycolic acids or other exfoliating agents, only because I want the skin to be a little bit more firm for that extra bit of anti-aging effect. You know, it will also help keep the skin very clean and at the same time work on the fine lines and wrinkles. So again, that is a group of cleansers. Then you also have probiotic cleansers, which have now been introduced for sensitive skin. It gives a very good pH balance on your skin, which will enable the other acne products to penetrate much better, giving you much quicker results. Now, it is not just the ingredients in your cleansers which is important, it is also the formulation in which it comes. Like for people who are having sensitive skin, if you are using gel based cleansers, it may be a little stingy to your skin or irritated, so you might have to use very gentle foam based cleansers or lotion based cleansers. Now, if you are a person with oily skin, then yes, again, foam based cleansers do work well, a little bit more stronger foam based cleansers, and even otherwise a regular cleanser should be good. Even a gel based cleanser will work good on these skin types. So there are so many things that goes into consideration before simply just prescribing a product for you. So once the cleanser is done, the immediate next thing that you need to do is moisturize your skin. Moisturizing is something that is very, very important, and it has to be done by all people irrespective of the skin type. If you are having dry skin, that means your skin may feel a little dehydrated and the skin barrier is lost. So what happens when the barrier is lost is, see, your skin cells are all, like literally just hugging each other and sitting there in a very tight manner. So what happens is, if it is dry, then small cracks will start to form in your skin barrier and a lot of products will start going inside. Essentially the wrong products, like dust, pollution, oil and everything will start seeping inside and it will clog your pores. That is why it is very important that people with dry skin tend to moisturize. You absolutely have to. Now, people with oily skin also need to moisturize, because when you are using products, obviously we are going to be prescribing products which will cause reduction in the oil control, and in some patients it may even go to the extent of causing dryness. So again, in a dry skin, if you do not moisturize, it is going to trigger your oil cells to produce more oil. So this cycle will continue, your skin becomes dry, then it produces more oil, and as a result you will not get oil control, and that will literally worsen the scenario. So moisturizing is of extreme importance for all the patients who are suffering with acne and even otherwise. Ensure that your moisturizers are lightweight, they are not too heavy on your skin. and that's what I have to give you about moisturizers. Then comes your spot treatments. Your spot treatments are essentially creams or ointments which will be applied to the areas where you have acne lesions. You can apply it to the complete area, or you can even apply it on the spots of your acne. Leave it overnight, leave it for a couple of minutes. It depends on the type of product that is being prescribed for you, and these also work wonderfully well, especially if you are having acne confined to certain areas. Okay. Now, when you are talking about acne confined to certain areas, always ensure that you are having your dandruff under control, because if you are having dandruff on your scalp, on any area wherever there is oil production, like your scalp, like your face, the T-zone, chest, back, you can develop acne-like lesions, and for that you also need an antifungal cover rather than just applying an antibiotic cream and so on. Okay, so that is something that you need to keep in mind. Now, topical agents, of course we do give antibiotics like clindamycin, which most of you might have used. This is just when you see an acne which has got that white pustule-like lesion. When you are having blackheads and whiteheads, you will essentially have agents like benzyl peroxide or retinoids prescribed to you, and then there are varying combinations which will be prescribed according to your skin condition. Okay, the only thing that you need to remember with a skincare product, especially if you're not getting it prescribed from a doctor, say if you're just going to pick it up by yourself, then the only things that I want you to look for in these agents, just remember 3 for convenience. Okay, the first thing is that ensure that in the packing it is written as non-comedogenic. You don't want any heavy product on your skin to go in again and clog those pores, triggering your acne. So always ensure you're using non-comedogenic product. Now, if you are a person with a little bit of dry skin, always tend to look for agents like hyaluronic acid in them, which will help maintain the hydration on the skin. It's very gentle product usually when you apply it to the skin. The third and the most important product is niacinamide. Ensure that you are having this product in your skincare or in your acne ointment, specifically if you're having sensitive skin or that red angry looking skin. Now, these are things that you need to keep in mind, and these are the 3 most essential steps. So once you're done with this, if you are having a simple acne, not much of a flare-up, then this alone will help control your acne lesions. But what about people for whom this alone is not helping? You need something a little bit more, and after discussing it with your doctor, you would probably just move on to procedural therapies. So when we are talking about procedural therapies, the most basic multifunctional and amazing procedure is chemical peels. I cannot stop talking about it because it is one of my most favorite treatment that I would love to do on all acne types, because it helps me use different chemical agents at the same time to get the desired benefit. Like if the skin is dry, I can use hydrating peels in one area. If I feel there is too much of redness or angry looking skin, I can use a little bit of antioxidants in that area. If I find acne confined to spots, I can use acne reducing peels in one area. So it lets me use so many products at the same time, and that will essentially ensure that it will give a very good improvement, not just in terms of your acne lesions, the number, the severity, but the skin quality as a whole will improve. The color and the tone of your skin will improve, and that is what a chemical peel can do. A lot of people think that chemical peels, if not now, can cause damages later in your skin, which is absolutely not true. It will not cause any damages later in your skin. So having said all these things, is a chemical peel without any side effect? Absolutely not. Any treatment, any procedural modality that you take do have some side effects related to it. And when it comes to chemical peels, the simple or the most common problems that we see is pigmentation problems. Now, this will only happen if the patient is not primed well, or even on the day of the procedure, if they have extremely dry skin in certain areas, they can develop pigmentation. Now, is this really bad? No, if you address this issue at the earliest. If you go back to your doctor at the earliest, they will decide whether you have to use a depigmenting cream over the area, or you can even get away without doing anything, because these pigment spots tend to fade away on their own. Okay, so that is all there is to chemical peel. So have this in mind, and it's an excellent solution for many of the acne problems. Now, moving on to the next problem. So whenever we find an adult onset acne, that means acne which is occurring in ages well beyond the teenage, we are finding finding acne has got a cyclical correlation, related to your menstrual cycles. Whenever you're suffering from conditions like PCOD or some other menstrual problems. Now, all these tend to cause these acne flare-ups not on a basic level. The flare-ups tend to become more, and it becomes very difficult to address this with just topical agents. So then what do? Then we always have to give an oral medication. So this oral medication could be in the form of a hormone replacement therapy in people suffering from hormonal acne. It could be in the form of anti-androgens, okay, again for hormonal acne. It could be in the form of retinoids, which is very effective for nodulocystic acne. And see, the thing about retinoids is a lot of people are worried that retinoids will decrease a female's ability to produce children, to give birth to children, which is not true. Once you stop retinoid for a couple of months, it gets washed away from your body, and it does not have any lingering effects in your body, or when you're planning for your pregnancy or giving birth. So do not have that misconception that if you use retinoids, it's going to tamper with your hormones and that's it. It does not work like that. So these are the oral medications that you need to bear in mind, which your doctor might prescribe to you, including your oral contraceptives, in case they find that the adult onset acne is more related to your hormonal problem. So moving away from these oral medications, we have management of acne sequelae. Now, I already told you that if a person has discarded acne as a very simple problem and has not addressed it at the teenage years, the problem is they continue to develop these flare-up of acne, and it comes to the point where the skin becomes scarred, okay? Because of the ongoing inflammation again and again, there's a lot of damage that happens to the skin, and there is scar tissue which forms on the skin, and it pulls the skin from below and leaves depressed scars on your face, okay? These are called as atrophic scars, which is a big problem among patients who are suffering from acne. So that is one thing that you need to keep in mind. And then of course the pigmentation problems. Like I said, chemical peels do help with a lot of pigmentation problems, but they do not have a major role when it comes to scarring, except for a type of scar which is called ice pick scar, and there is a technique called TCA cross redo for this type of scar. Understand that again the scars are of different types, and based on the scar you have, a combination of treatments will be given to you. But on an overall note, if you want to know what are the treatments available for scarring, I would just like to name a few, because you have probably heard it from your doctor or dermatologist, and these are the most commonly done procedures. One is subcision. You remember the scar band that I said will keep pulling your skin from below? Subcision is a procedure where we go in with a needle or with a blade, and then we tend to manually cut down these bands. So once the scar bands are released, your skin tends to lift up and it looks more normal and natural. Okay, so this is what subcision essentially means, and this can be combined with other procedures. I love to do micro needling on most of my patients who have scarring, because it works on different types of scar, and it also helps lift the skin because it stimulates the collagen inside your skin. It is a protein which gives your skin that elastic nature, right? So any procedure which will stimulate your collagen will lift up your skin and make it look much better. So I like to do a lot of microneedling procedures, and of course, for those of you who are very worried about the textural differences on your skin, your scars might be too deep that it might look a little too crude on your skin. Fractional lasers are a way to go, because they will help balance the border of your acne scars. So what they do is they level up these scars in relation with the surrounding skin, so they will not make it look as severe as it was. So fractional laser is again another beautiful procedure that you can do, especially if you're suffering from a lot of scarring on your face. Now, having done all these things, your scars cannot or do not completely go away. Okay, we can get rid of majority of your scars, we can make your skin look so much better, but there is always a remnant of scars which you will be seeing on your face. So what do we do about that? Say if you're a person to get married and you want to have that good polished skin, you don't want to have or see much of those scars on your skin, then we also do something called as hyaluronic acid fillers. We do it as a monotherapy, or we combine it with other procedures. So essentially what we are trying to do is, these are all like holes or gaps that is forming in your skin, right? So we are trying to fill in a product so that your skin will lift up on top. Again, this is a very simple procedure. It gives you immediate results and most of the patients are happy, but bear in mind that this is only a temporary solution. You will have to come back for a repeat injection if you need it after 8 to 12 months. So that's about fillers. Okay, so these are some of the basic things that you need to know about procedures. Now a lot of people come to me and they ask, is there something I can do at home a little bit more than my acne management so that I feel better, that I'm doing something for my skin? Then yes, blue light is the way to go. Blue light therapy really helps with acne because it targets the cutis bacterium acne, which is responsible for causing acne. It helps control the bacterial growth and thereby reducing the acne lesions as well as the severity of acne lesions. We also find that this blue light helps with the redness on the skin, so it is a good modality of treatment that you can do at home or in the dermatology office. So that I think is about the management per se, but please bear in mind a lot of lifestyle changes and diet modifications need to be done. Just to touch upon that before I finish, when you are talking about lifestyle, your hydration should be on point. Okay, now I say this because skin is the largest organ in your body, and it tends to dry out a lot because of the constant exposure to so many things. So if your barrier is not intact, like I already discussed, a lot of things can go inside and can trigger a process. Okay, so that is essentially how a dry, dehydrated skin will react, which is why you need to keep your hydration levels on point. Of course, there is no research that has proven that lack of hydration is directly correlated with acne, but we do see it, and you will probably be able to notice it yourself if you're dehydrated, how your skin is, and then when you're fully hydrated, how your skin is. So that's the first thing. Second thing is, I tell my patients to have a lot of nuts because they have a lot of zinc in it and it really helps with healing the lesions. I also advise them to take a bowl of vegetables at least 3 to 4 times a week, because we know that they have all the minerals and nutrients that you need, that your skin needs to help repair whatever damages happen. So that is something that you need to bear in mind. Then coming to stress. We all know stress is related to majority of the skin problems and hair fall problems. The reason as to how it is related is that when you're continuously stressed, your body will produce a CRH hormone, okay, which is a corticotropic releasing hormone. Now what this will do is, it will directly go and it will impact your oil glands. It will stimulate it to produce more oil, and we all know what happens when there is excessive oil produced, right? It's going to clog your pores and cause more acne. So try ways and means to reduce your stress levels. It could be singing, dancing, playing, whatever it is that you want. So make sure that your stress levels are maintained. Then comes sleep deprivation. We also find that a lot of people who have disturbed sleep, they go to sleep very late, and wherever there is a disturbance in the sleep, again it kicks off your hormonal balance, and again that triggers your acne problem. So keep that at bay. Then one worst habit that you need to get rid of is touching your face. And not just that, a lot of people, especially young women, have the habit of oiling their hair and leaving it overnight and then washing it off the next day. Well, that is your personal preference, but remember, if you're a person with acne, what happens is that oil will drip from your scalp onto your skin, again clogging pores, causing more acne. The other thing is that when you are lying down, again your oil may seep into your pillow covers, and the next day you may wash off your hair, but there is still oil in the pillow covers, and when you are rubbing your skin against your pillow, again that will trigger your acne lesions. As simple as these things are, these lifestyle changes need to be done to get that sustained good results on your skin. So these are some of the basic things that you need to keep in mind. And last but not the least is your diet and acne. So when it comes to diet, there are just 2 things that you need to know about. One is dairy. By dairy I mean milk, milk-based products, cheese, paneer, everything. And then comes refined sugar. I'm not going to talk about milk because it's a relatively blurred area. There is no definitive correlation for all acne patients and milk. You find it very rarely. I'm unable to, in my experience, I have very rarely correlated it for my acne patients as a trigger, because most of my patients, when asked for the history, they hardly have a glass of milk a day, which I think is bad, by the way. But so I have not seen it in my practice, but maybe I could, I don't know, I could be wrong. That is up to you to have research and find out. But what I do find significantly is when there is increased intake of sugars. When there is increased intake of sugars, what happens is the insulin levels in your body will go up because the sugar level has gone up, and that will release a lot of insulin-like, insulin-mimicking growth factors. Now that will again have a direct impact on your acne, which is why you need to really cut down on the sugars. And not just for acne patients, for anybody who wants to have a good skin on the long run. If you cut down your sugar, then yes, you are going to get that skin of your dreams. Now do understand that when I say cut down, it doesn't mean for a day or two. It means if you even want to see the changes that it has or the impact that it has on your skin, you need to give it a period of 4 to 6 weeks. And the same goes with your skin treatment. A lot of you, a lot of times are in so much hurry that you want quick results. Acne does not work like that, okay? Since we are giving a combination of treatments, we have to let your skin breathe in between the treatments, and your treatments would be probably slow, okay? But that is what is going to give you a sustained result. So please be patient with us. We are here to help you, hold your hand and walk you through the procedures we are going to do and tell you what is going to happen next, but you need to be patient and give us the time. And for you to label that the product is not working or it is not suitable for you, you should have used it consistently and correctly for at least a period of 4 to 6 months. So let me finish off with this. Whenever a product is prescribed to you or any product that you choose over the market, always ensure to do a patch testing with it. Okay, it might be a very good product, but it might just not suit your skin. So always take a little quantity of the product, and after cleansing the area behind your ears and neck, apply a little quantity of the product. Leave it on for at least 24 hours. Wash that area and observe for any redness, bumps, itching and whatnot. So if none of those things are appearing in these areas, then you're probably good to go with the product. Okay. So always make sure to do the patch testing for any product before you put it on your skin, and always start slow. So don't jump in and put 5 layers, 7 layers of skincare. Always start with 1 or 2, and then you can gradually step up your management. So I think we have covered pretty much all the things that we need to do with your acne management. We have touched upon the lifestyle modifications and the diet and its relation with acne. If you have any queries, please keep them coming. I will try to address these questions at least in the next 1 or 2 days. And with that, I'd like to conclude. I hope all of you stay back at home and stay safe. If you want to know more about acne, more about the newer technologies or treatments that is available for acne, please give us a call at Signature 18 Clinic. And I'm Dr. Swetha. Thank you for watching the video.